let's discuss another, say, one of the three important tests in hip examination. To be very frank, these are the only three tests which I would expect every examiner or every postgraduate to do for every hip case. So that would be Thomas test, Trendelenburg test, and lastly the Telescopy test. So these are the three T's of special tests in hip examination. So I hope my screen is visible and I'm audible.
Yes, sir. It's visual and you are audible.
All right. So what is Telescopy test? So basically, Telescopy test happens to be a provocative test. That means you want to check whether a hip is stable or not. So this test is going to uncover any instability which is present in the hip joint. Okay, so this is a provocative test. How do you do this? So a few prerequisites for this particular examination is that the patient should be lying down on a firm mattress. It should be a relatively pain-free hip. It need not be completely pain-free, but it should be enough so that the examination can be done without causing much problem to the patient. Apart from that, a free flexion should be possible up to at least 60 to 90 degrees. This is important because that much amount of flexion is expected in the hip joint to perform a good telescopy. If the hip is not able to be flexed till say 90 degrees, then say if you're only able to flex the hip to 30 degrees, then a few examiners do expect you to perform the telescopy test at 30 degrees and replicate the same 30 degrees telescopy on the normal side as well. And just to compare between the normal and the abnormal, normal and the examined side. Okay. Apart from hip flexion, even a little bit of hip abduction, adduction should be possible at the hip joint. So the method for doing this test, the patient should be supine and the examiner stands on the same side which is being examined, with the same side as the hand, if you are examining the right hip of the patient, then the left hand, okay, so imagine it's the right hip is being examined, then the examiner has two hands, okay. With the left hand, the examiner will grip the hip such that the thumb lies over the anterior superior iliac spine and the fingers go around the greater trochanter. And with the right hand of the examiner grips the knee or the distal thigh of the patient and flexes the knee to 90 degrees and the hips between 60 to 90 degrees. So you flex both the hip and the knee joint to between 60 to 90 degrees. Then you slightly adduct the hip. Adduction of the hip is performed. And after this, in this position, inline compression and traction is given along the long axis of the thigh. Inline compression and traction is given along the long axis of the femur or the thigh. Okay, so imagine this is your patient who is lying down on the couch. Then if this is the right hip which is being examined, then with the left hand, the thumb goes over the ASIS and the fingers go around the greater trochanter. Then with the right hand itself, you will hold the knee joint, flex the hips to 90 degrees and the knees to about 90 degrees. You will slightly adduct the hip joint and then you will give axial compression and traction alternatively in line with the long axis of the thigh. Now, if there is an unstable hip, so if you can see from this is a stable hip, and in a stable hip, if you give axial compression or traction, there is no movement. So there is no movement felt on the tips of your fingers. So that means the GT is not moving. Okay. However, if you see this region here, imagine there is a post-septic sequelae or a girdle stone arthroplasty which has been performed, which renders the hip unstable. So in an unstable hip, whenever you want to give this sort of inline compression and traction, then around your fingers, you will be feeling that the hip is moving. The greater trochanter is moving when you give axial compression and traction. Okay. So this is about telescopy test.